Patrick, it's lovely to have you here today, mate. Give us a little introduction to yourself and what you're up to.
Yeah, thanks, Johnny. I'm Patrick. I run a software agency called Adapt. We've been going 9 years now. We specialise in building software to streamline operational procedures, make organisations tick more efficiently, essentially, leverage technology. And about 18 months ago, we started finding ourselves doing increasingly more work in the healthcare space. And that's somewhere that's really connected with us now on both a commercial level, obviously, but also more importantly from a personal level. It's such an honour to be able to build software that has such a tangible impact on people's lives. So
incredible, man.
That's what we're doing.
Well, we're here today to talk about Digital Health Rewired.
Good to be here. Yeah, it's good to join you and chat about Rewired.
Yeah, I can't believe it's been a week already.
It's crazy.
It's flown by. Yeah. Apparently, time does fly when you're having fun.
Who knew?
Yeah, exactly. So obviously we divided and conquered on the day, and we went to various different talks. I've got the list of them here. The first one was obviously building smarter hospitals to digitally enable better patient care, smart hospital sensors and tracking, intelligent workflows, enabling NHS recovery through patient process mining, AI automation and design, strategies on digital inclusion and user-led design, future gazing and smart tech in action, driving patient-centric innovation, inside track digital twins in health, developing a patient-centric approach in a digital age. And there were so many more. So it's fair to say we're going to have a lot to talk about today.
Yeah, it's a good job we didn't get to all of them.
Oh, God. Were there any particular things that stood out for you as themes, topics throughout the couple of days?
I mean, there was just a general consistency and inspiration and topics that are just so engaging and so relevant and current as well. I think there was a general undercurrent of the challenges that face the NHS, but also to match with that or compete with that was the desire to improve it, the desire to keep it here and do what needs to be done to keep it alive for, I think I heard recently it's been around for 75 years or something, and obviously we want it to be around for another 75 and more. So yeah, I think it was just generally a really inspiring day, and some of the innovations, some of the exhibitions and things that were on show there were also incredible in between the talks. So
yeah, I think that stood out for me as well. I think there's so many, the stands, the people, everyone, there's a genuine feeling of wanting to help our NHS. There's a genuine feeling of wanting to do better by patients. Yeah. Big themes around obviously empowering patients with data centricity, connecting the dots, and allowing the NHS to use digital properly as the longest lever that I think you and I both know that it is to deal with some of those challenges that the NHS is facing. Yeah. And I think one of the things that really stood out as a slightly antagonistic point was what is perceived as quick moving in healthcare systems as opposed to what we're used to, which is obviously fast moving return on investment in tech.
Yeah.
I think it was a year and a half, someone said they'd like to see return on investment. And obviously in our world, you want to see a return within a month or two, after you launch a product. And that can be kind of like a 3-month sprint cycle. So you're literally looking at that return in four months.
Certainly less than 6.
Yeah, 100%. What were some of the other themes that stood out for you in terms of things that you really picked up as points that you'd like to potentially dive into from any of the talks?
I mean, yeah, as you said earlier, there's just so much. I think one of the points you mentioned a moment ago that jumped out to me was digital inclusion.
Yes.
And naively, it's actually something that when it was spoke about at the conference, I sort of considered that I might have overlooked. And being someone who's digitally capable, digitally comfortable, it didn't dawn on me that there was such a void in society that don't have digital capabilities. They don't have access to the technology. They don't have the knowledge to utilize it fully. They don't have the trust in it. One interesting point that came out to me in that particular conversation was this transition that we've gone on in the past 5 or 10 years, where as people have become more digitally comfortable, things that you would have first initially considered completely ridiculous, like banking online and buying your food shop online, and all these things that we just take for granted and do every day these days, for a lot of people is still so far out of reach.
Yeah, we're still in a massively transitionary period with healthcare where I think the number that was thrown out was 10 million people don't have the basic skills to access digital tools. And that throws a lot of questions right back to the beginning about, are the tools themselves broken, or is it people's ability to use them? And I think there needs to be a lot more education, and that's one of the things that stood out for me with that digital inclusion piece. And completely like yourself, I'm someone that's very comfortable, very capable with digital technology, and we exist in a world that actually we're probably a lot more used to dealing with digital natives. People that have grown up with devices, or if they haven't grown up with devices kind of evolved whilst they were young enough to start using them and be interested. But yet we know that there's an aging population. There's a whole raft of neurodivergent people that need to be considered as well in terms of like their interaction with things. There's a whole list of other challenges with patients, especially with conditions like stroke or other conditions that might limit your dexterity.
Impede them, yeah.
And it's one of the things that really occurred to me was I reflected back on seeing a lot of these interfaces that were being designed, and I really did think to myself, on the patient side, they're still quite intricate. They're still quite, high fidelity, really kind of detailed.
Arguably overwhelming.
Overwhelming that's exactly the word that I'm looking for. And I think that that's something that we really probably need, what we do need to tackle. We need to come back to first principles in terms of what are the tasks that I am looking to achieve as a patient? What creates psychological safety for me? Because if you don't feel safety in something, coming back to your point about trust, then you don't feel trust in it, and then you don't end up using it. And this tool that should be really powerful for you falls by the wayside.
Yeah. I think more importantly on that safety point is if you don't feel safe, you won't bother or you won't want to spend the time to build the trust in it. Trust isn't something that comes automatically. It's something that's earned through a good onboarding or a good experience and all those things. And it goes beyond digital as well, obviously. But I think there's one of the points that came up on this top subject was around communication.
Yeah.
I think it was the second biggest complaint or something with the NHS from patients was either a lack of communication, overly complicated forms of communication, too much information at any one time, missing communication, so going to one hospital, one surgery to another, and the other not having the information from the one you're originally at. All these gaps they just cause fragmentation and distrust. Ultimately.
I think the communication piece is huge. I think both from the system talking to itself and sharing of pilot studies or things like that. So if you've got one hospital over here that does this amazing pilot study to solve a particular challenge, well, they should be signalling to other trusts, other hospitals, other groups, this is what we're doing. There's learnings and knowledge here that you can benefit from, and that creates that trickle-down effect.
Yeah.
And that kind of ripples out. Unfortunately, what it seems like a lot of things that we heard on a couple of days were you've got a lot of people trying to solve problems in silos.
Silos, yeah.
And that doesn't create a cohesive solution. And that's where ultimately I think we really need to get to with potentially considering that return on investment piece that we spoke about. Yes, there is a challenge around wanting to do a small project and have it get success and have it be recognised, but equally without thinking about the wider ecosystem challenges, that then presents another problem, which then becomes a bigger problem actually, because it compounds the siloing issue that we've got. And then, as you say, patients don't get what they need because they're confused about all of the things that they need to use. And there's differences in, I can get something from here in a plain language summary or whatever, and I can get something from here and it's different. And like,
polar opposite. Yeah, exactly.
What am I supposed to do with it?
Yeah. Cohesion, consistency, all of those things, they just go out the window when things operate in silos, especially when something is seen as a single entity as the NHS.
Yes.
But within it, it runs so fragmented.
But again, that's an understanding piece, and this is something that you and I think we're on this journey of learning, where, like many others, we assumed that it was one body, one institution that would, of course, be connected seamlessly, because that's what we're used to with digital data architecture, and that's how it works. And that's actually another theme that we can touch on as well, where we know that there is this want for machine learning, artificial intelligence, and other digital tools to be utilised. But the challenge there is the data integrity. The quality of the data that goes in isn't going to be of a high enough standard that you're going to guarantee a positive outcome at the back of it. Obviously, this is an area that you're much more familiar with than I am.
Yeah, this is a conversation that's coming up increasingly frequently in my world, just in general, but it scares me, the fact that, I use the analogy, and I think I've used it with you before, but the analogy of like comparing technology to an alphabet, and your AIs, your machine learning, all these advances, these new technologies are the XYZs, and we haven't even got the ABCs down in so many areas, especially in healthcare.
Yeah.
The overuse, and it was shared in the conference from a point of view of recognition, the fact that spreadsheets are being massively overused in the healthcare space. But I think they're used out of probably out of a variety of reasons. One is probably a frustration with the other systems that exist, the usability or lack thereof of those other systems, the complexities of them, the fact that a lot of things are probably still paper-based, and the next best thing is probably a spreadsheet.
But that's a challenge as well with the aging population. You've had this evolution in terms of digital technology over the last 50 years where patient records can be more digitised, but yet we've still got a huge cohort of patients for whom their records are only paper-based. Everything that we have as a point of reference for them that we could use as insight or use as a point of generating insight from a lovely data set is now unavailable. Like, it's all based in paper. It's all hard copies that essentially if a hospital goes up in smoke or a GP's practice goes up in smoke, they're lost. Yeah. And, the model occurs to me that it worked at a time when if you only ever saw one GP for the entirety of your life and you didn't move from that one place, that was fine. You needed to know the GP, and that was it, because they had a record of everything and they knew you.
Yeah.
Now we're in a much more globalized society. People move around from place to place, and not just in kind of like different counties in the same country, but across different geographies, across different countries. That challenge of healthcare records and the way in which we pull it all together is huge. And that was another key thing that kind of stood out for me from a lot of the companies that I was seeing on the day. They seem to have really narrowed in on that as a point of focus and tackling electronic health records.
Yeah, absolutely. Yeah, it was on one of the stages. I think it was the data analytics and AI stage. I think his name was Louis Coles. He spoke about Optica and the impact that's having in allowing them to increase their discharge rate.
Yeah.
And actually, I think the NHS is faced with a struggle, and probably most healthcare organisations are faced with a struggle and a pressure of trying to pull in or bring in more patients, push in more patients into the system because there's such a demand on it.
Yeah.
But actually, if you don't focus on getting them out the other end, then there's no room for them to come in.
Yeah. And it's not just about getting them out, it's about getting them out, but also empowering them with enough knowledge.
In a way, they don't circle back round and come straight back in again.
It comes back to the communications. It comes back to those plain language summaries. What do I do if I'm discharged and I start exhibiting these symptoms again? What's my port of call? Who should I contact? What do I do with my medicines? How do I make sure that my medicines are being reviewed all the time? How do I make sure that the GP has the up-to-date information from my discharge from the hospital? All of these things are considerations that need to be thought of when someone's being discharged from a hospital. And this is, again, where it all comes down to communication and education. I think we all take for granted, or many of us take for granted, the fact that these things might happen automatically because it's an experience that we have in every other space.
Yeah.
But it's not occurring in the most fundamental space, which is our health.
Yeah, exactly.
Yeah,
there was a phrase that I heard on the day a few times, that health is what happens between doctor's appointments, and yet we just go from doctor's appointment to doctor's appointment or hospital visit to hospital visit.
Yeah.
As you say, there's not enough effort put into. Prevention is obviously another common thread that is talked about in healthcare in general, but especially at the conference. I can't remember the stats now. I don't have them in front of me, but I think it was around like 40% of losses are coming from not focusing enough time on prevention.
Wow.
Which is, it's just crazy.
Yeah, it really is. When you think that ultimately the prevention is better than cure. So that's where you want people to be. You want people to be empowered with their health, with decisions that they can make. And that's where it comes down to utilising, again, not just utilising technology in the setting of a hospital. And that's where I think it's really interesting that obviously we focus a lot on this conversation as well, and on the days that we were there's a lot of focus on the NHS, but I also think to that point that you've just made, there's a lot of focus that we need to do within that, within the surgeries, within GP surgeries, within the care that someone can receive upstream, and then ahead of that, even themselves. And telling someone what they can do with, their Apple Watch, their Whoop, their Oura Ring, whatever it might be. Okay, what picture does that paint of your health in a meaningful way that if it's fed to your doctor, they can then communicate to you? We're seeing some variations, like that digital system could be so light touch in terms of the daily involvement that someone has with it, but it could be preventative and interventional to make sure that those outcomes for patients are...
it could be instrumental, it could be invaluable to healthcare professionals. Like, as you say, getting a clearer picture of what's happening between those doctor appointments, especially if you're undergoing cancer treatment or something as horrific as that. Not knowing, only having those touch points where you come in for an appointment, you come in for a treatment, and you're only monitoring the progress at those periodic points, filling those gaps, I could only imagine could be instrumental in helping someone down their path.
Yeah, it would be absolutely massive. I think, one of the key challenges that exists there, though, and this is something that was spoken about on the second day with Orca, was verifying those apps and making sure that if there is a digital technology in place by someone who is, let's assume, well-meaning and well-intentioned, because I believe that most are, that those apps are verified by clinicians, by doctors, by some means and mechanism that means that there's a quality assurance to it. And that's another huge step that needs to be taken. I think there's 350,000 health apps in the App Store at the moment.
Yeah.
And only a tiny percentage of those are actually verified as, being clinically viable or something that someone would recommend as a pathway. That again is one of the other challenges that exists, right?
Yeah, absolutely. I think some of the scary things here, and this kind of bleeds slightly beyond just the realm of healthcare, but some of the metrics, some of the stats that people rely on or have relied on previously for, I guess, checking the potential reliability or trustworthiness of an app, like the reviews or like the number of downloads.
Yeah.
They're not trustworthy metrics anymore.
No, not at all. I mean, we all know, to use a very basic example, the Amazon reviews. You go onto an Amazon product, you see, it's got 5,000 positive reviews, 4,999 of which are positive from a bot, and the one negative one from a genuine customer has found its way all the way down to the bottom of the stack.
Yeah, exactly.
And it's that same thing with these health apps, and that's one of the most important ways in which people look at something. They look at community as a trust marker. So that's another lever that I think we need to pull on in order to make sure that people have the right, again, it's communication, right?
Yeah.
The right thing in their hands that's going to help them with their recovery or preventative journey, and make sure that they've got all the right tools to deal with their health.
Absolutely. When you were talking there, something else that jumped out at me, and this ties back in with the kind of digital inclusion point, was around just general digital education. I think, as you say, there's such a large percentage of society that didn't grow up with technology, weren't at the kind of time in their life where adopting technology was a natural thing to do. It was very forced. It was very kind of very much a challenge for them. Still is probably to a lot of them today. And I think that is part of the issue is a lack of education around some of these markers to look out for, or just some of the everyday things that you and I do that we don't really think about. It's just
100%. We take them for granted.
Natural, yeah, exactly. Natural markers, natural indicators that we go, yeah, that looks trustworthy, or it doesn't.
But even that spidey sense that you have where actually, if you are a digital native or someone that works within digital a lot, you often have the ability to pick up on subtle cues anyway. You can verify whether something's legit or not. You'll look for certain trust markers. If you go for a website as a basic example, you'll look for the padlock at the top to make sure that it's got an SSL certificate.
Yeah.
It's little things like that. But if you don't have the training, or you haven't grown up with it, and you haven't, got that spidey sense, for want of a better term, I can't think of what else it might be, to do that, it becomes an incredibly overwhelming and challenging position to be in, and you feel this, like, it's almost like stepping out into the void. And this is something that I think is a real area of potential focus for us as designers, developers, and people operating in the design space, to bring that more empathetic lens to say, actually, let's take something back to first principles. Let's start looking at this from the ground up. Does your user actually understand how to use this?
Yeah, absolutely.
Do they actually know the benefit that this will bring them clearly, and how they need to engage with it in order to achieve and get that benefit? If they don't, then we really need to start looking at coming back to basics. We need to start looking at information architectures, what we're showing on the screen at any given moment in time, to make sure that it's not overwhelming for them, and also explaining things with plain language.
Yeah.
And not overwhelming people with acronyms, like 4-syllable words and other jargon, which we're all familiar with.
Is rife in healthcare, we know.
Oh my God, yeah, it literally is. It's just, why explain something in 10 words when you can summarize it in 3 pages?
Yeah, exactly. And something else that jumped out to me as well was the this kind of, and I don't think this is siloed to just healthcare, but this desire to focus on like shiny objects.
Yes.
And try and find a problem for a solution rather than focusing on if there's a problem in the first place.
Yeah.
And if there is, don't just jump straight to how shiny of a solution can we create. If it does just need something as straightforward, some instances a spreadsheet is applicable. A spreadsheet can be the solution. In a lot of places, it's probably a good place to start, but they quickly run out of runway of their usefulness and I guess robustness in terms of integrity with data and everything else. So they're invariably better than probably paper-based systems.
Yes.
But they probably don't go much further than that, unfortunately.
Yeah.
But yeah, just this nature to almost, with all the innovation and everything that's happening in the sector, it's almost like trying to find a problem that can allow people to use that solution, rather than starting with what are the problems and let's work on solutions to those. If some of those innovations, some of those new introductions to technology and everything else are solutions to existing problems, great, use them, fantastic. But like, let's flip it back to focusing on the problems, not on what the solutions, not on the kind of shiny objects. Yeah. Yeah,
jumping into solutions is always a challenge. It's everyone's natural lean to, I think, by default. We all want to solve the problem. We hear something that's a challenge, like, oh, here's a solution for it. The first thing that we should be doing is actually, as you say, interrogating the problem itself in the first place and saying, is the problem that we have an assumption is the problem actually the problem?
Or is it a symptom?
Is it a symptom? Is there something else that maybe further down the line is what we should be considering as the actual derivative cause of that? One of the questions that I was going to ask you, obviously we've spoken a lot about some of the challenges that exist, but what are some of the things that you saw that gave you hope for the tackling of some of these challenges from the talks that we saw and from the people that we met?
So just looking at my notes here, actually, I'm glad you brought that up. So one of the things that that really impressed me was just learning more about the NHS App and how that's progressing. And I think there's obviously a need for it to continue down that path. And to continue expanding, continue growing. But I mean, the fact that we sent like 56 million messages through the NHS app in 2023 is amazing. They're reportedly on course for a £20 million cash saving in 2024. Like, metrics and stats like this are just incredible to see through something which is, again, to a lot of us taken as second nature.
Yeah.
But actually...
But equally, these are things that don't really get shouted about.
Yeah.
I mean, would you have found that, if you hadn't have attended, this conference, would you have found out about that?
No, absolutely not.
Exactly. And this is part of the communication challenge that I think that exists. And we need to get better at communicating the value that's being served. We're really not good at it at the moment, or I say the healthcare system at the moment really isn't good at that.
Yeah.
And those are incredibly powerful statistics that you'd think would lead to some optimism. That we're heading in some sort of right direction, but it's just not being communicated out further.
Exactly. Yeah, it seems like very much almost an internal discussion. It's an internal topic rather than something that I think would help to, again, come back to the point of trust, help to build trust in people to continue that growth, continue onboarding more of us onto using things like the NHS app.
Yeah.
Conversely, one of the frustrations where I think only a small percentage of patients are actually able to book appointments and things with their GP. Not all GP practices are. I think my GP practice isn't on the NHS app yet, so I still have to call up and wait on a phone line to try and get an appointment.
Yeah.
And again, as being someone who's digitally sort of comfortable and competent, it's frustrating that I can't just go onto my app and look at their calendar, look at my calendar, book in something that's convenient for me.
And equally, that compounds issues with other challenges. If you move house, for example, you should just have a simple portal that you can go onto and update your personal details.
Yeah.
Your personal information, should be very simply in your control. But as you say, if there's a centralised hub for that, the NHS app, then that just feeds through. You update your personal details there, it goes out to all surgeries, everything's linked together, happy days. Unfortunately, that's just not the case at the moment, and it's a sense of frustration that I get from a lot of the people that we heard speak on the day. That centricity of data and the quality of that data to be able to use it, that would be there if actually a little bit more freedom and flexibility were given to patient ownership of that part of the problem and conundrum as well, is part of a bigger consequence later on that we need to deal with.
Yeah, I think beyond ownership. Or even before ownership, I think just transparency is a key part. I think just patients, and I guess in the case of the NHS app, users knowing where their data's stored, what data's being held, etc. Having access to that, I think is just integral to the foundations of trust. Is an openness and transparency and honesty.
Yeah.
I don't think there's anything dishonest happening with the NHS, but I think it's a technical challenge that needs to be overcome in order to bridge that gap in trust.
Yeah, I agree with you. And this stood out for me with the challenges that they're facing with certain aspects. It stood out from the sensors and tracking conversation. When we're looking at devices that are being launched in terms of something that you put on your side and measures your respiratory rate. And so that means that the nurse going around and checking someone that may have a respiratory condition, cystic fibrosis or something like that, they don't need to go around and measure manually the rate of someone's respiratory rate. They can rely on a read. It doesn't mean that they're not going to go in and still look at that patient, but they have a tool. But then it opens up challenges around, IT systems. How does that product then integrate with the IT systems? IT will obviously have a conversation with facilities and estate management as well with other bigger solutions. So that's one tiny little device that integrates with IT. But if you take that out towards energy savings, energy crisis, and also the simple fact of global warming and challenges that we face around climate change, one of the other challenges we need to tackle there is how do we reduce energy consumption within hospitals for operating theatres, which was raised up as one example in this hospital in particular, so that we can diminish the energy demand without turning something off, because IT teams are terrified of turning things off in case they don't turn on again. But then that means that you're going to have this conversation between IT, you're going to have the conversation between the estate and facilities management, and then you're going to also have the conversation with clinicians, surgeons, nursing staff and all that sort of stuff. So there's multiple levels of communication and openness and transparency, as you said, that needs to happen. And it really does serve to highlight that's just one hospital. How you manage that at the scale that we're talking about as a whole kind of, countrywide entity.
Yeah.
That's a whole minefield.
It's almost unfathomable, isn't it?
It really is. And it does give you some kind of understanding and sympathy for the challenges that everyone's facing.
Oh yeah, absolutely. Yeah, let's not rush to make this sound like it's a flick of a switch solution here. Like the problems we face are like diverse and just considerable, significant. I think it's very easy to, when you go to a conference like this and you hear about all these possible solutions and the problems that are being faced, it's very easy to come away and just think, oh well, we'll just do this, then we'll just do X, problem solved. But the actual implementation of those solutions, and as you say, the various layers and teams and departments and organisations within the NHS that then need to be on board with that. It grows exponentially, doesn't it, the complexity of it.
And then I think that leads very nicely onto the question around the role that, designers and development agencies and teams can play in serving and helping, to tackle some of these changes.
Yeah.
I think from what I'm seeing very clearly, there's a communication challenge, there's a transparency challenge, there is a need for these different trusts, hospitals and teams to communicate, to create steering committees, to create bodies that actually are dedicated to the sharing of knowledge from one study to another. What are some of the other aspects in which you think that design and development can play a role and help with some of these things?
I mean, it's less of one of the things that jumped out to me there, which is less of a way that I think that sort of our services could help, is the ability for us to be able to help. I think one of the poignant things that came up in some of the talks at the conference was around procurement, and just the process of being able to help an organisation like the NHS is just, words can't express how agonising it is. And the timelines that were spoke about in terms of getting some of these solutions into place that could potentially plug a gap and fix a problem that exists today sometimes takes years to get them into place.
Yeah. 6 years on average.
Exactly. In that time, the problem has no doubt changed. The solution, no doubt, therefore needs to change. We're constantly playing catch up. We're constantly 2 steps behind. I don't understand at the moment, unless that aspect of things changes and we're able to. I've heard from politicians and social media and things that there's a desire to kind of open the door more for suppliers, providers of our services and others to be able to get into the NHS and help more readily. But I think unless that happens, it almost doesn't really matter what solutions we've got, because by the time we are able to implement them, the problem's changed. Yeah,
I think that lends itself probably to a conversation around digital agencies and teams that are on the slightly smaller scale of size comparable to something like an Accenture, a Deloitte, or a big consultancy.
Yeah.
I think there is a conversation that means actually, no one of us is stronger than all of us. And do we actually have to start thinking about, okay, if we want to solve these problems, collaboration is key.
100%.
And pooling those resources that we have so that we can prove a capability that's much stronger together than it is apart. That seems to me like maybe that's a way in which we could start to tackle some of those issues that procurement often have with the agencies that they want to work with. Because the reason that they want to work with those smaller agencies is they're smaller, they're more nimble, they're able to churn out work far faster with a much higher quality. The responsiveness piece is huge, because they're not burdened with multiple layers of bureaucracy. They get stuff done. And that's really, really important, especially when it's patients' lives that are going to be impacted
100%.
by it.
Yeah.
The challenge becomes the person looking at the balance sheet or going, oh, you're not large enough for us to feel comfort working with you. But hang on a minute here. You can work with this big monster
conglomerate.
And they're going to take 1.5 years to implement a solution. You can work with a smaller agency and you'll get a solution in 3 months. And we'll be testing it. You'll have a dedicated team of resource. You're going to have boots on the ground that are actually helping you and like really engaged with you, because we want to be, as opposed to just kind of like you're just a sort of line on another. 100%. So that's something that really occurs to me. Collaboration as another key takeaway from that. I think this was the patient centricity talk, And that was one of the themes that came out of that, which was collaboration is key, both with other agencies and also patients. It's really funny that a lot of the time we jump to solutions, as you were saying earlier, without even talking to a patient. Like, are the solutions that we're proposing actually meaningful to you? Like, is this something that you'd like to see? You know, some basic qualitative and quantitative research would go a long, long way 100%. To providing a good steer, right?
Yeah. I mean, in any other world, in any other commercial or otherwise, in any other kind of business, it starts with the end user, right?
Yeah.
It starts with the customer. And in healthcare, the patient's the customer. And yet we're constantly, as you say, getting distracted with symptoms of problems, or loud voices invariably. That, like, we really fundamentally need to start with who's going to be, in theory, benefiting from either solving a problem that exists or improving the way that we operate. And as you say, ultimately it's the patient.
Yeah, 100%. Were there any kind of standout moments for you throughout the couple of days that really kind of, you've mentioned a couple of things already, but was there any single standout moment for you on the couple of days that you just thought, wow, that really has blown my mind?
I mean, on day one, the first talk I went and listened to was on the cyber stage, and being a techie, it was obviously quite engaging. But the response to the incident that happened, I think, in 2021, where I think an NHS trust, I believe, was either hacked or suffered from a technical issue that resulted in their systems being down for 108 days, which is just, I mean, in our world...
I mean, that's a third of the year.
Yeah. And in our world, if something's down for a day, it's pandemonium.
I mean, 24 hours and the sky is falling.
Yeah, exactly. So the level of resilience in that scenario to find quick solutions, temporary sort of fixes to enable healthcare to continue being delivered, was just amazing. Like the response to that challenge, and also the resilience from the individual. I think it was Professor Daniel Ray who was giving this particular talk, and the response to to that incident and the way they approached sort of resolving that and finding existing solutions that were not as good as what they had in place with their system previously, but was able to allow them to keep moving forwards. That sort of I guess desire to, or need rather, to just keep things moving forwards in such a intensely stressful scenario. I can't even imagine what that must have been like. But I think what's interesting is one of the first questions that's asked of us and of any, I think, technical department or any technical individual when something like that does go wrong is how long. Like what?
Oh, 100%. The timing question is always the only one. Yeah. It's not really even a matter of cost. Oftentimes it's how long is this going to be down for? Doesn't matter what it costs. Fix it.
Exactly. Yeah. And one of the really important things actually stood out to me. I think it was Martin Sadler that was on stage with Daniel, that he mentioned was the need to protect those that are working on the fix, that are working on trying to get the system back up and running. And it's understandable, but it's so common that when something does go bang, that the phones just light up. And unless you have the correct policies, procedures, and I guess layers to a certain extent. We were talking about trying to simplify layers earlier on, but in this instance, having those layers there to protect those that are on the ground actually trying to get systems back up and running, it just makes it so much longer.
Yeah, it really does. It really, really does. And having that person that's willing to put themselves in the firing line in many cases, as you say, to protect their team, because that team is already fighting a fire.
Yeah.
They don't also need to be having the finger of blame pointed at them as for why it was kicked over in the first place. Those conversations can be saved for later. You can do your retro, you can do your wash up, you can find what it was that went wrong in the first place and tackle it to make sure that it never happens again. But in that moment, that doesn't matter.
Yeah.
It's only about fixing it.
Exactly.
And that leadership is really important as well.
There was a common thread between those two talks on that stage as well, that and I think this is fundamental to why both of them are still in their roles today, which is they documented everything. every decision that was made, every incident that was discovered, every problem that was uncovered, everything was documented, and every instance communication as well. Everything was logged, and that way everything is crystal clear what happened, what the response was, why those decisions were made, who made those decisions, etc. I think ultimately in those sorts of unfortunate scenarios, too much is done to rush to solve the problem, and not enough time is taken to document the process and make sure it's in an easy to understand, easy to recall way for the future. One of the kind of closing remarks was, why don't we plan to fail? So many organisations, healthcare included, obviously, are so busy just running the day-to-day that we don't stop to think, actually, what if something goes bang? And one of the actions that they took as a result of this disruption was to run unannounced hack days. So now there will be days in this trust or in this hospital where they will intentionally disrupt the service in a reliable and a safe way, away from live data, etc., away from the day-to-day running. But the IT department will come in and they won't expect one of these unannounced hack days, but it's there to test the systems, to test that when something does actually go wrong, they can respond to it.
Yeah. I mean, that, again, it just blows my mind that this is something that someone would not share with a wider ecosystem of hospitals and trusts and things like that. This is obviously an amazing series of procedures and processes and things like that. There's so many things to talk about there. I think the preparing to fail is vital. Creating a plan for what's going to happen once something has gone wrong is really, really crucial as well. I also think that one of the things that people miss is in failure there is opportunity. And actually, sometimes those failures lead us to better solutions and better planning in the future. And so actually planning to fail and having those controlled experiments where you have that hack day where something can go wrong, okay, we need to fix this now, that's a really vital part of the process. And it comes back again, it's to kind of stress testing. We've got all of these digital solutions that are being offered. What happens at load?
Yeah.
What happens when it's really stressed and stretched? What happens if there is another coronavirus outbreak or another pandemic and we're flooding these systems with data and people are trying to get some safety, like some self-assurance or some assurance that they're going to be okay and what the right information is that they need? Those are things that are vitally important. And so those failure protocols are vital in making sure that they can continue to run. That's something that I really do believe is often overlooked, and it's part of the reason that when we talk about user experience and we talk about the role that design and dev can play, when have you ever launched something without testing it? And you continually test it even after it's launched.
Yeah.
You have to make sure that it's viable and that it's going to stand the test of time for a number of months and in some cases years, so that it's fit for purpose. It seems like a very fundamental and basic practice that hasn't been picked up, but yet it's so taken for granted with what we do, and it's just not found its way over the other side.
Yeah.
Again, there's so much that I believe that these systems could benefit from working with agencies, from design thinkers and leaders that would add value, significant value.
100%.
But it's just getting through the barriers of procurement, as you say, and those challenges, and maybe there's other things that we need to think about around that.
Absolutely. Yeah, the when you were talking there, I know it's a bit of a cliche phrase, but the phrase that jumped out to me was fail forwards. I know it's probably quite an overused phrase, but it's so true. Failure is not a bad thing as long as you learn from it. If anything, it's a good thing. If it's not disastrous, if it doesn't completely destroy the scenario where it's happened, if you learn from it, it's the most valuable thing that can happen. I think there's several people that I follow that are constantly talking about trying to fail more rapidly and do more experiments, test more things. Ultimately, you can speculate as much as you want, but until you actually pull the trigger, for want of another overused phrase, you're never going to know the response. You're never going to know the outcome.
And I think as well with that, if you're not failing, you're not pushing hard enough towards a better solution.
Yeah.
And there's obviously percentages of which you accept failure, and
Exactly.
we're getting into the weeds of all of that stuff. But equally, the important thing there is the first principle of we need to be failing, we need to be pushing, we need to be expanding our horizons constantly, because if we're not, then we find ourselves in a position that we're not prepared for some eventuality that might occur 2-3 years down the line, or even sooner maybe, or even longer, who knows.
Yeah.
The time horizon doesn't really matter. We're not prepared. And if we find ourselves in a lack of preparedness, then we have 108 days with an outage that means that people can't get the care that they need, and everyone's scrambling around to find solutions.
Exactly.
That's not tenable.
Absolutely. Just to finish on that particular stage, one of the things that was painfully obvious was, and one of the reasons I think that we ended up in this situation in the first place was just a sense of naivety. It won't happen to us.
Yeah.
And I think you shouldn't fear failure. You should almost lean into it, as you say, prepare for it, be ready for it, so that when it happens, you can respond.
Yeah. And that's another thing that stood out from the process mining and automation. That's where digital can actually protect you. You have those processes in place, you have these standardized procedures in place, and understanding what needs to happen, when it needs to happen, and what you can do to protect against it, that offers you so much more assurance in the future that you can continue to deliver the quality of service that you ultimately want. It's a really interesting area to kind of unpick, and it's equally one of those areas that I think there is so much opportunity for collaboration within healthcare systems. As you mentioned with that hospital, they've done that work. That should be being shared.
Yeah.
And they should be finding opportunities to engage with other colleagues and say, we think you could benefit from this knowledge, and understand how they can do that.
Exactly. Yeah, it's that ethos of being able to kind of test failures made me think of the digital twinning from the AI. I think it was from the AI stage.
Yeah.
I think you might have listened to that one. I wasn't there for that, but just this idea of being able to run tests on theories and see what the results are, sort of in a simulation environment, and in theory test sort of fail without the fear and the challenges it throws up.
Well, I mean, the digital twinning space throws up so much opportunity, even within hospital design. When we were looking at when we were there, and it was building better hospitals, and then the sensors and tracking, the opportunity to model a hospital and have a physical asset, then the digital replication of that, so that you can run different scenarios, tests, and all that sort of stuff. That is such a powerful tool. And the same thing with us as being the asset in terms of like our physical health and what we want to do. But again, the ethical part of that as it relates to the human is another consideration. That was something that was really interesting to me on the day, that came out of a question that someone raised about, with a little bit of knowledge in the hands of a patient as to the digital twin, could we open a Pandora's box of people being really worried and overly concerned about their health based on these models that, may lead them to kind of just hide themselves away from the world? And that's a really interesting space, I think, because digital twins, as far as a hospital goes, offer so much possibility in terms of how we might be able to tackle inefficiencies and improve the system overall. In the hands of the patient, it's a really interesting conundrum about how much knowledge is too much knowledge, and how do you protect people from themselves in some cases.
Exactly. Yeah, I've actually just invested in a glucose monitor.
Yes.
To track that, and I mean my dad sadly suffered with diabetes type 2 as well. So I don't know if it's hereditary, but if it's coming for me, then I don't know if I want to know. I'm a little bit anxious about using it. But
well, it's better to know. In my opinion, it's better to know.
Exactly.
But then I think you and I are both quite action-orientated people, not very likely to bury our head in the sand with something like that.
Yeah.
But that's something that's a really interesting, you raise a point there where it is, is there a psychological impact that could be felt by someone having access to a digital twin that lets them know, okay, you're at risk of X, Y, and Z, and they're suddenly forced to face a series of tough choices around their lifestyle, and when they say, I don't want to make those choices right now, I'm only 30 years old. And actually, well, you kind of have to. If you want to have a quality of life that's greater than, I think it's a really depressing statistic at the moment. We're in a situation where in the US, life expectancy is actually falling.
Yeah.
And that is the first time that that's happened in something like 60 odd years. It's insane. So we need to start making
something's got to happen. Yeah,
we
exactly.
need to start making informed choices. And I think that digital tools and innovations like digital twinning, as was discussed on the panel, really does throw open a world of possibilities with that. And again, it's about patient empowerment. It's about empowering them with enough knowledge to be able to take charge of their own healthcare, because in the systems that we have at the moment, the simple reality is they're overstretched. There's too much demand, not enough supply, and we need to use whatever tools we can to enable better healthcare outcomes for patients that don't need a clinical intervention, that need a preventative solution. You really well made that point earlier about prevention is one of the areas that we probably need to focus on more.
I think it's key.
And it's just not happening. There's kind of like a little bit of a focus on the panaceas, the AI, the tech, the data that's going to solve all of our problems and save everything.
Shiny objects.
But we need to bring it back. We need to put a little bit of responsibility, accountability and ownership in the hands of our patients and in the hands of people that can do something with it. Leverage this digital technology that sits on all of our wrists and what have you. And with some basic communication, let's educate people, upskill them in digital tools and make sure that they know how to use these things that they can benefit from, and empower them with enough knowledge to make a positive choice. If you do that, that to me is a much better spend than trying to build a all singing all dancing tool for a struggling system.
Yeah. No, absolutely. Yeah, again, it comes back to that fundamentals, doesn't it? The point you mentioned there about the life expectancy issue reminded me of a couple of standout moments on that particular subject. I think across the north of England, in one of the trusts, the life expectancy can vary by 10 years or something, north and south of this. I can't remember particularly where it was, but it was definitely a North of England trust, and it was something like 10 years east and west and north and south. But also, more importantly, our life expectancy in the UK at least has increased, but the years of
quality,
exactly, good life in those years is decreasing, or certainly not increasing at the same rate.
And that's the thing that I think everyone listening to this, watching this, or anyone that wants to live to a certain age, you want to reach that age physically capable, able to be mentally and cognitively there. And if you're in a position where essentially you're just being for want of a better term, existing with a pharmacological or medical intervention to keep you going,
kept alive,
that's not living. That's just an existence.
Yeah.
And so I think that that's a really important thing. And that highlights that point there with the north and south divide, east and west. That highlights some of the economic disparities, the impacts that economics actually play. We've obviously had the last however many years of the Tory government talking about this levelling up. But equally, this is what we're seeing playing out in the US as well, in terms of the worst outcomes occur in the poorer communities. And so how do we, again, empower those people? How do we give them the tools and the means that they need that don't cost the earth? In many of these cases, it's purely the benefit of knowledge and purely the benefit of being able to understand the consequences of a choice they might make. Maybe don't have a hamburger. Maybe have, a chicken breast, if, whatever that might be.
Yeah.
Those are things that were really interesting to me from the days in how we bridge the gap. I think that's the phrase I'm kind of looking at as the most important, is bridging.
It comes back to fair opportunity.
Yeah.
And arguably equality and all these other things, all these other challenges that face us, again, beyond the scope of just healthcare, but they all have a tangible impact within the healthcare ecosystem as well. They're such sort of extensive challenges, and they're certainly not easily solved, but they're the fundamentals. You need to get those things right before trying to plaster patch something with a shiny new piece of AI or something like.
I think I'm gonna reiterate and steal that phrase that you mentioned, about the alphabet. I think it's coming back to that. We can't solve X, Y, and Z if we don't have A, B, and C solved.
Yeah.
And we need to tackle those fundamental problems, as you just said, and those fundamentals before we can start to really move the needle further on other challenges, on other things that we might want to have an impact in. And that's where I think, again, coming back to more of a design focus, that's where I do believe that design agencies and development agencies can have a hand in bringing it back to the user experience part. It's the user research, it's the understanding of the problem and whether it's the right problem to solve, and then being able to offer a solution off the back of that that's appropriate.
Yeah, absolutely. I'm going to flip it back on you.
Fire away.
What stood out for you? I know we've probably touched on a lot of the subjects, but was there anything that we haven't touched on yet that?
Wow. I mean, there were so many things that we've already discussed. I think the ethical considerations around digital twinning were something that I had not considered around the patient side of things, from a healthcare, trust, hospital, whatever you want to, physical thing there. That no-brainer. Seems completely obvious that you would do that.
Yeah.
Lots of investment should happen in that. But from the patient side of things, until the point got raised around how that might negatively impact the psychological state of someone, I hadn't thought about it. And it highlighted to me the perfect point that I think you made at the beginning, where it's like, we take these things for granted.
Yeah.
We know how to use these tools. We know how to control our use of these tools because we've become so familiar with them. In the hands of someone not so familiar or well-trained, that becomes something entirely different. It becomes something that actually, aside from being something that should create a better outcome for them, could create a negative outcome for them.
Yeah, it almost becomes a risk. Absolutely.
Yeah, and that was something that was really, really interesting to me. And the other thing that really stood out to me was on the last day, on the second day, where Rachel from Sing Health, or SingFit, sorry,
that's it,
SingFit, was showing us this amazing video with treating dementia and cognitive impairment with singing, and how simply singing with simple cues can have such an impact in someone's ability to become and transport themselves back to who they are and who they were. And that was something that really stood out for me as kind of, again, really simple, really, you wouldn't have thought that's a very
almost
sophisticated,
overlooked, right?
Completely overlooked. And, things that stood out from that really brought back that focus onto, okay, let's approach the problem from first principles. Let's look at what the problem really is. Are there any lower fidelity solutions that we could use and leverage that would have maximal impact? And seeing the impact on those videos was just something that really blew my mind.
Yeah, I mean, the thing that first of all, what a way to start a conference on the second day.
Singing Tom Jones.
Yeah. But also the sense of connection that gave not only us in the room, but the video that they showed as well. The connection between that particular individual and their caregiver. Like, it was instant. They were both singing away, like, enjoying each other's company. It's amazing. I hadn't really considered the power of song. I'm by no means a singer, but it was fascinating to start the day like that. And I feel like everyone seemed to hang around after that talk a lot longer and connect and network, I guess. I think a lot of the other talks that were, I suppose, a little more traditional were people kind of dispersed very quickly from those. But everyone seemed to hang around after that, which is really fascinating to me.
Yeah.
But yeah, like you say, that sense of connection. And I think that is... I think we forget that patients are obviously ultimately humans. And I think it's very easy, especially in the scales that we're talking about in the healthcare system, it's very easy to just look on them as problems that need solving. They've just got an ailment, they just need a drug, they need some sort of treatment. Actually, if you bring the human element back to it, that sense of connection can almost restore a lot of those problems. It's been talked about, I know, in the media and elsewhere, that this sense of disconnection in the world and loneliness, especially in more elderly people, is just devastating. And it's causing a lot of physical ailments as a result. So I think the opportunity behind something like SingFit and other organisations striving for similar towards similar solutions is just so
it's massive.
invigorating.
Yeah, and it's seeing the impact directly is just the game changer. And feeling it, as you say, it's you see the wave of happiness move through the room, and how people then carry themselves off the back of that. It was a game changer. So yeah, for me that was the standout.
Yeah, definitely.
By a country mile.
I think connected to that one, actually, I don't know if it might have been in the same talk, actually, but there was the Smiley Scope as well, the implementation of Smiley Scope in maternity wards to help with procedures and reducing fear and anxiety, and in, I think, a lot of cases was reducing pain scores as well, by using a VR device to transport someone elsewhere mentally, cognitively, whilst they're undergoing a treatment.
100%.
It's crazy.
Being taken away from a situation in which it could be kind of, stressful, uncomfortable, and very unpleasant, just giving them something else to look at and listen to and experience something different. Again, dealing with that trauma, removing some of the trauma from that situation in something that is already a traumatic situation. Obviously, in those situations, it was particularly centered, if I'm not mistaken, around kind of miscarriage and helping ladies deal with that. So that's something that I think is, again, it's not a super technologically advanced lever that we're pulling on here, but it's just a simple solution that actually has a real applicability and scalability as well.
Oh, crikey, yeah, absolutely. My wife sadly suffers. She had to go undergo a bunch of treatments as a young child, and as a result has developed quite a severe sort of lab coat, white coat syndrome. Whenever she goes into any hospital, it doesn't really matter the extent of the severity of the procedure she's undergoing. It can even just be a doctor's appointment, and it sends her into spirals of anxiety. We've tried multiple things, like having headphones on when she's having her blood taken and things of that nature, blasting music into her ears to, again, I think all in an effort to try and transport her elsewhere and give her something else to focus on. So that really hit home with me as something that is just so widely applicable and could benefit so many people, not just in that particular use case.
Yeah,
it's crazy,
mate. I think that's probably a beautiful place to wrap it up.
Sounds
I think
good.
Tom Jones and
Tom Jones and VR.
Tom Jones and VR. And
what better concoction?
Absolutely. Who'd have thought Tom Jones was a healer? It's not unusual.
There it is.
Mate, it's been an absolute pleasure having you. Thank you so much for sharing your thoughts from the day, and for also being there on the couple of days with me.
Thank you.
Nice to have someone to tag team with it.
Absolutely. Yeah.
Mate, we'll do this again.
Sounds good. Thanks very much.